Hi, this is Dr. Tom Kuivila. I'm the Residency Program Director in Orthopedic Surgery at Cleveland Clinic. You are listening to Interview with the Surgeon with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Tom Kuivila, Program Director of Orthopedic Surgery at Cleveland Clinic. Doc, how are we doing today?
Doing very well, Matt. Thanks for having me.
Thank you for being with us. So getting this started, what were your goals and aspirations during your residency, and how those changed throughout your fellowship?
It may sound cliche, but when I started my residency, my aspiration was fairly simple, just to be the best possible, well-rounded general orthopedic surgeon I could be. When I started, I really did not understand the concept of even doing an orthopedic fellowship back then. Probably 1 in 5, 1 in 6 orthopedic surgeons went on to do a fellowship. And so I was just really focused to be just the best operative technical surgeon I could be. And my goal was to finish residency in such a way that I would set myself up for the best possible job that I might be able to find. I knew going into residency that I was going to be spending some time in the United States Air Force following residency. And so I kind of envisioned being a general orthopedic surgeon, taking care of active duty troops, sports injuries, the occasional weekend trauma. And at that point, we were at peace. There was no sense that there would be any armed conflict. So I really wasn't thinking about major trauma as part of my future practice. By the time I finished as I got close to the end of my residency, I was obviously thinking much differently. I had very different goals. I, at that point, wanted to do a fellowship so that my 6 years in the Air Force wouldn't be spent at a very small Air Force facility where my skills would potentially erode. So I wanted to do a fellowship and end up at a major medical center so that I could then have the sort of practice that I had been accustomed to as a resident. In other words, interesting, complex, and sometimes difficult cases.
Just kind of taking us through that fellowship year, what was the mentality going into your first job search, since that kind of was a different situation for you?
It was a different situation. So my mentality during the fellowship was to try to parlay that fellowship into, again, the best possible Air Force assignment. After 6 years, I was about to enter the job market, and I really was at a loss in terms of understanding the negotiation process in the Air Force. All of the patients, of course, there was no copay. There was no really requirement at that time in the Air Force in terms of documentation. So I was pretty much unaware of, different levels of billing, new patient, established patient, consult, and certainly we weren't worried about CPT codes. Somebody magically took care of that, if that was even being done at all. So going into my first job search, I was still, well, as I said, I was naive, and I was looking for simply the job that would provide me with the most professional satisfaction, and which I would hope would be a fun lifestyle.
It's kind of taking us through your journey. What all did you have to go through in order to become the program director of Cleveland Clinic?
Well, I have to say that the Air Force was helpful in that regard. My second tour of duty was at Wilford Hall Medical Center, which at one point was the Walter Reed equivalent for the Air Force. It was a 1,000-bed hospital and was very academic. We had a 5-person per year orthopedic residency program. And about 9 months after I arrived there, the program director at Wilford Hall decided fairly abruptly to leave the Air Force. And he called me into his office and said, "I'd like you to be the program director." Well, I was 37 years old. And while I was anxious to do it, I didn't know much about it. So I looked into what exactly that would require of me. I thought, this is kind of what I'd like to do. I like education. I like working with the residents. So it made perfect sense to me to take over as the program director. So as a program director, in San Antonio for 2 years. And then upon arrival at the Cleveland Clinic, I talked to John Brems, who was the program director at the time, and told him I'd really like to help him out. And so I became his associate. And for the first 5 years that I was there, he ran the program and I took care of the schedule. I learned a lot about how the ACGME worked and requirements for board certification, many of the things that we're all supposed to know, but don't necessarily know in residency. And when he decided to step down, I took the reins, and that was almost 21 years ago. So I've have had a good run at it so far, and hope to continue for a little longer.
Now, throughout your career, were you academic focused all the way, or did you ever consider going private practice?
I actually did give some consideration coming out of the Air Force into going into private practice. I looked at a couple of opportunities, and they just didn't offer the same breadth of pathology that I had become used to. In the Air Force, despite the fact that everybody in our 9 staff, let's see, what would that be, 20 resident department, despite the fact that I don't think anybody was over the age of 50, we were responsible for the biggest cases that the Air Force had. And one of the most memorable things that I participated in while at Wilford Hall was a separation of some conjoined twins. And surely if this had been done at Mass General or Children's Hospital of Philadelphia, the newly minted orthopedic surgeon wouldn't necessarily have been leading the orthopedic team. But I had the opportunity to do that. And as a result, I really didn't want to go back to doing, not to be disparaging, but I didn't want to go back to doing pure bread and butter orthopedics. I wanted it at that point. I knew I wanted to be at an academic center where the cases were challenging, and you had the opportunity to work with residents, because at Wilford Hall, our residents were superb, and it was just such a good environment. I wanted to continue that.
Now, has your passion always been on the pediatric side, or were you focused on adult as well?
My first 3 years in the Air Force, I was, despite having completed a PEDS fellowship at that point, I was only doing about 30% PEDS. So I was doing 70% adults. So I was doing discs and hip and knee replacements and young adult arthroscopy. My focus in terms of going into PEDS, it was really, I didn't know if I wanted to do, I knew I wanted to do spine in my practice because that was something that I was exposed to quite a bit as a resident. And there are 2 areas in orthopedics where you can do spine. One would be in PEDS, where you do deformity. And if you're just a pure adult spine surgeon, you do a lot of degenerative things. And I was torn between the 2. And the year I was applying for fellowships, lo and behold, the Air Force was looking for PEDS people, not for adult spine people. So that made the decision easy.
Now, as a program director, what advice do you have for the graduating chief residents and fellows entering the professional job market for the first time?
I think you need to be very aware of the market. I think you need to know if you're focused on a particular area of the country, as opposed to just any academic job or any private practice job, whatever. I think you really have to know the lay of the land. Our experience at Cleveland Clinic when we initially branched down into Florida was difficult. The people in Florida didn't want the Cleveland Clinic coming there. And in much the same way, I think you need to know if you're being hired as a hospital-based orthopedic surgeon in a town or in a city where they already have a lot of private practice people, you may find that allegiances are such that you're not going to get referrals from the family practitioners. You might get the cold shoulder from other orthopedic surgeons. So I think a sense of the environment is an important thing. I think it's also important to know your value. It's instilled in orthopedic surgeons and in medical personnel in general that our profession is one of we're servants, and I think that is still the case, but I don't think anybody wants to get taken advantage of. So I think you need to know, what your value is to the hospital, what your value is to a particular group, as in private practice group or academic group.
Now, as we went through 2020 with the pandemic, most of these annual conferences were all canceled. And so dealing with this virtual aspect, what advice do you have for the graduating class regarding their networking and outreaching process when really they would be trying to meet folks like you at conferences?
I think it's important to be adept at the new world of virtual conferencing, because when the pandemic is finally over, I think we're going to see a lot of people still working from home, a certain number of days a week. I know one of the resident applicants that I interviewed today asked me what we were going to do with our conferences once the pandemic ended. And I said, we're probably going to do something of a hybrid. So it's important for the folks now who are interviewing to know how to interview on camera and to be comfortable with this sort of interaction. And there's also a lot of ways to get a sense of a community, get a sense of a hospital by going online and looking at the websites of the hospital, the websites of the group you might be joining, looking at maps of the city, looking at things from the Chamber of Commerce. All those things are going to help you get a better feel of a location if you can't travel there. And certainly you can get a sense of people, I think, on a video link.
Now, as you know, this podcast has really been focusing on the chief residents and fellows, but strangely enough, a lot of medical students have been watching this podcast as well. So I'm just curious, what are you looking for when you're interviewing med students for residency spots and also residents for fellowship spots?
Well, we have a pediatric fellowship, so I'm involved. I'm not the program director of the fellowship, but I'm involved in the interview process. The thing that I like to see in residents, since it's a 5-year program, I'm looking for people who have resilience. There are a lot of variables thrown at an individual during a residency. There's a lot of variables from day to day. You go into the hospital and you don't know exactly what's going to happen. So you have to be flexible. And when things don't necessarily go well, you have to have resilience. And I think that's an important trait. Teamwork is always important. This is not a solo sport. It requires, in the operating room, you might have 10 people in there at any one particular time. A couple doing anesthesia. When you do spine cases, you have a neuromonitoring person. You have x-ray coming in and out. You've got circulating nurses. You've got a scrub tech or scrub nurse, and there are 2 or 3 people around the patient. So being able to work in a team environment, to know when to lead, know when to follow, is really important. I also tell people that the 2 traits of humility and, first, humility, I think, is very important, because you have to be humble. We operate on a patient, we make a skin incision, we do something to the bone with a plate and a screw, and then we close it up and we're high-fiving each other. But we're not really responsible for the healing that occurs, the tissue, the bone, and that sort of thing. So we're not miracle workers. We're physicians and we're technicians. We're doing things, and the body is healing. So I think not having a God complex is really important. And that humility that you have, knowing that what you do helps, but is not the end all. The other aspect from humility is a sense of gratitude. I think everybody that goes to medical school is immensely privileged to take care of individuals who really trust you. You have to be there for them. You have to be available, and you have to show a great deal of compassion. So having that sense is, I think, really important. And hopefully the fellows exhibit it that much more, because they've been through a residency and now they understand just how important those things are. Sometimes people come by those traits naturally. Some people need a little bit of help to recognize just how fortunate they are. We had a conference not long ago where a patient came in, and the man had some considerable means, and he was making a fairly sizable gift to the department. And he was talking about how grateful he was that, he was able to have care, that, people really cared about him, and that had he been in his native country, he would never have had the same care. So he was talking about how, to him, how grateful he was and how he thought that it was so important that all of us recognize just the things that we'd been given.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.